Okay, so welcome everyone. So today we'll be starting off with a new series on psychopharmacology of lithium. So in front of us we have a question from INICET November 2023, where a pregnant woman who was on lithium prophylaxis for a bipolar disease came for follow-up in third trimester and reports adequate symptomatic relief. So what should be done next? Okay, so A. Stop lithium. B. Decrease the dose. C. Increase the dose. And D is changing to valproate. Okay. So here we have a situation where a pregnant woman who is sh- in her third trimester is coming to us, and we have the option of either stopping the lithium because she is very well controlled on the bipolar disorder, or can decrease the dose. Increasing the dose doesn't seem to be like necessary in this case. Apparently, like, let us see into the explanation. A change to valproate. Okay, maybe. So the answer of this question is decreasing the dose of the person. Okay, so we will decrease the dose. So the question actually states about the woman being in the third trimester of pregnancy, and she might be approaching her labor at this point in few months or few days. So what actually happens? So there is a fluid shifting that happens. As the fluid shift occurs during second semester, there's a whole lot of fluids. Okay, so during delivery you can see there is a whole lot of concentration is happening. The fluid has decreased because of the loss of amniotic fluid and the baby coming out, and after delivery the fluids are almost not there, which is like back to the normal. Okay, so here lies the danger of toxicity. Okay, so this was the logic behind decreasing the dose of lithium. So what exactly is happening? It's something like this. So with the increasing volume of fluid during the pregnancy, we need to increase the lithium dosage just to keep the therapeutic levels. But as soon as delivery occurs, the fluid volume shrinks and there is a very high chance of toxicity. So, as to prevent this toxicity to happen, we have to reduce the dose of lithium. Okay, you can see over here. See, this is what Kaplan Sadok also talks about, that there is a massive intracompartmental shift of electrolytes before, during, and after delivery, which can make a sudden lithium toxicity possible. Okay, and this is what is happening during the delivery. So before the delivery, what was happening is there was increasing glomerular filtration. So more and more amount of lithium was being thrown. See, this is what is written over here. So lithium clearance rises throughout the pregnancy as GFR also increases. So a fixed dose gradually gives a lower blood level, and many patients need their doses increased across the first two trimesters just to stay in the therapeutic line. See, so this is what is happening during this phase. It's like a flight of blood volume, along with also there has to be a flight of dosage in order to maintain the therapeutic levels. Okay, so this sudden volume loss leads to sudden increase in concentration of lithium and precipitate toxicity. Okay, so this is what it is, and that's the logic behind decreasing the dose of lithium. Let's look at the other options. So stopping lithium outright is reserved for the day or two immediately before the delivery. So had it been the question uh, just before delivery, okay, so just before delivery, then this might have been the right option, option A. Okay, okay, let's just look at the other questions, other options. C is ignoring the delivery related toxicity risk. Why? Because increasing the lithium dosage after delivery means already the volume is shrunken. Over and above that, if you increase the lithium, you will just exacerbate the lithium toxicity. And why not change to valproate? Well, the simple reason being valproate, number one, give rise increased risk of neural tube defects, as well as uh, there is no rationale for changing to valproate because lithium is already working in this case. Okay, so to summarize, in the first and second trimesters, we need to gradually increase the lithium dosages. In the third trimester, when the delivery is approaching, we need to decrease the lithium dosage. Immediately before delivery, you need to stop it because there will be a rapid volume shrinkage. Okay. Thank you. Hope you have learned something from this lecture today.